My name is Dr. Sam Baxter, originally from Little Rock, Arkansas. So I specialize in doing a direct anterior total hip arthroplasty as well as total knee arthroplasty, and I also specialize in doing a bikini incision anterior total hip arthroplasty. The direct anterior total hip arthroplasty is a very anatomic way to be able to replace the hip as we're going around muscles rather than through muscles. And the next step in making things fully anatomic is doing it through a bikini incision, which follows the natural healing lines of the skin, which leads to easier recovery time as well as a better scar. There's a common misconception with total hip and total knee arthroplasty that you need to wait until the very last second before you have the procedure. There have been a lot of advancements in total hips and total knees to where people can recover a lot faster, and they do last longer. So if you have hip or knee osteoarthritis and your knees hurt you and they keep you from doing things that you want to do, or your hips, please come into my clinic and we'll discuss all the treatment options at that point in time. It could be something non-operative, or it could be moving forward with a total hip or a total knee arthroplasty.